Welcome to San Jose State's Narcan distribution program. In compliance with SB 367, the Campus Opioid Safety Act, college campuses are required to provide educational and preventative information about opioid overdose, information about the use and location of reversal medications such as Narcan, and to participate in the Department of Healthcare Services Naloxone distribution program. The following training is adapted from San Diego State University's Narcan Upstandard Distribution Program. Purpose of the training. In 2021, there were nearly 6,000 opioid-related overdose deaths in California. Recent data suggests that number continues to increase. As an individual, you can play a role in saving lives and stopping drug overdose by sharing the signs of an overdose, promoting the use of naloxone, having conversations with peers about the dangers of fentanyl, the risk of mixing drugs, and the life-saving power of naloxone to reduce the stigma around seeking help, treatment, and care, promoting California's Good Samaritan Law, which protects those giving emergency medical care at the scene of a medical emergency, including giving naloxone, and by sharing treatment resources like the 24/7 national helpline 800-662-HELP. Before we begin, let's walk through what the training will discuss. 1. What are opioids? 2. What is naloxone/Narcan? 3. How does Narcan work and how to use it? 4. How to respond to an overdose situation. And 5. Prevention. What are opioids? Opioids are a class of substance that bind with opioid receptors in the brain. Opioids reduce the intensity of pain signals and the feelings of pain. Opioids can be natural, meaning they are derived from plants such as the opium poppy, synthetic, meaning they are completely man-made, or semi-synthetic. Types of opioids. There are different types of opioids which include, number 1, prescription opioids. Example of this type of opioid are morphine, hydrocodone, and oxycodone. Number 2, synthetic opioids. An example of this type of opioid is fentanyl. 3, illegal drugs. An example of this type of opioid is heroin. Now, let's take a deeper look at fentanyl. Fentanyl is a synthetic, man-made opioid that can be lethal in small doses. It is up to 50 times more potent than heroin. For clarification, fentanyl does have legitimate uses in the medical setting. It can be used under strict medical supervision to assist with severe pain. This slide does not refer to fentanyl in the medical setting. It is about fentanyl found in illicit substances, which include any substances purchased online or through social media. Fentanyl has been found in cocaine, heroin, meth, and counterfeit pressed pills posing as Xanax, ecstasy, Molly, Adderall, and oxycodone. Individuals that never intended to use fentanyl have died from fentanyl overdoses. Buying pressed pills from a U.S. pharmacy is the best way to ensure they do not contain fentanyl. What is naloxone? Naloxone is a medication used for known or suspected opioid overdoses. It is an opioid antagonist, meaning it acts as a blocker that stops opioids from binding to the opioid receptors in the brain, thus countering the effects of opioid overdose. Naloxone is intended for immediate use in emergency situations where opioids may be present. Naloxone is available in 3 forms. It is available as an injectable that requires a trained professional or administrator. It is also available as an auto-injectable, commonly known by the brand name Evizio, and it is available as a prepackaged nasal spray, commonly known by the brand name Narcan. Narcan is pre-filled, needle-free, and requires no assembly. The remaining training will focus on naloxone in the form of Narcan. Narcan. Narcan is a medication used to reverse an opioid overdose in both adults and children. Narcan is contained in a white device that is about 2 inches long, pictured on the screen. The device delivers an intranasal naloxone spray that is only intended for use through the nose. 1 device equals 1 dose. How Narcan works. When an individual is given Narcan, it will act as an opioid antagonist that stops opioids from binding to the opioid receptors in the brain, thus countering the effects of opioid overdose. Narcan will only work if a person has opioids in their system and will have no effect if opioids are not present. Its effects last about 30 to 90 minutes, and Narcan can be administered by lay people. This means it could be administered by you, a roommate, a family member, or a friend. It is important to note, however, that Narcan is not a substitute for emergency medical care. Administering Narcan. In California, there are state laws in place to support bystander intervention and encourage individuals to take action in an emergency situation. Narcan administration is covered under the state's Good Samaritan law. Narcan is a non-scheduled, non-addictive medication, and according to the FDA, there are no harmful effects from administering Narcan to an individual that did not have opioids in their system. If you suspect an opioid overdose, even if it's from a combination of opioids and other substances, Narcan should still be administered. Recognizing an opioid overdose. An overdose occurs when an individual consumes a toxic amount of a substance or a combination of substances. An opioid overdose occurs when an individual consumes a toxic amount of opioids or a combination of opioids, leaving them unresponsive. Signs of an overdose can include unresponsiveness to verbal and physical stimulation or unconsciousness, breathing that is not normal, it's slow and shallow, uneven, or stopped, lips and fingernails that have a blue or grayish skin tinge, and snoring or gasping sounds. Responding to an overdose situation. If you come across someone that is unresponsive and you suspect an overdose, start by stimulating them awake. Either shake their shoulders or yell their name, ask them if they are okay. Check for visible signs of an overdose. If the individual is unresponsive and an opioid overdose is suspected, administer Narcan as quickly as possible. Call 911 as soon as possible. Notify them that Narcan has been administered, update them on the individual's condition, and stay by their side until help arrives. The following video will walk you through how to administer Narcan.
Narcan nasal spray is not a substitute for emergency medical care. As with any drug, you need to be aware of important safety information concerning its use. Please see indications and important safety information at the end of this video. Also, please see accompanying full prescribing information in the use of this product. Narcan nasal spray is an emergency treatment for a known or suspected opioid overdose. The appropriate use of Narcan nasal spray can help you save a life. Narcan nasal spray is not a substitute for emergency medical care. As with any drug, you need to be aware of important safety information concerning its use. If you encounter someone who is unresponsive and you suspect an overdose, first shake their shoulders and shout their name.
Kevin.
Ask if he or she is okay.
Hey, can you hear me?
Check for signs of an overdose. Unresponsive to touch or voice. Breathing is slow, uneven, or has stopped. Snoring, gasping, or gurgling sounds. Fingernails or lips are blue or purple. Administer Narcan nasal spray as quickly as possible if someone is unresponsive and an opioid overdose is suspected, even when in doubt, because prolonged respiratory depression may result in damage to the central nervous system or even death. Lay the person on their back to receive a dose of Narcan nasal spray. Remove Narcan nasal spray from the box. Peel back the tab with the circle to open it. Remove and review the printed quick start guide inside the package. Hold the Narcan nasal spray with your thumb on the bottom of the plunger and your first and middle fingers on either side of the nozzle. Do not press the plunger to test or prime the device. If you do, you will waste all or part of the dose of medication. Tilt the person's head back and provide support under the neck with your hand. Gently insert the tip of the nozzle into one nostril until your fingers on either side of the nozzle are against the person's nose. Press the plunger firmly to give the full dose of Narcan nasal spray. Remove the device from the nostril after giving the dose. After you have given this medication, seek emergency help right away. Narcan nasal spray is not a substitute for emergency medical care.
I'm with somebody who stopped breathing. I think they've had an overdose.
Move the person on their side after giving Narcan nasal spray. If possible, put their hands under their head and bend their upper leg forward. This helps prevent the person from rolling onto their stomach. This is known as the recovery position. Continue to watch the person closely. If they do not wake up or respond to your voice or touch, Or if they do not seem to be breathing normally within 2 to 3 minutes, use a new Narcan nasal spray to give an additional dose in the other nostril. Acute opiate withdrawal symptoms may occur from use of Narcan nasal spray in patients who are opioid dependent. Symptoms include body aches, diarrhea, increased heart rate or tachycardia, fever, runny nose, sneezing, goosebumps, also known as piloerection, sweating, yawning, nausea or vomiting, nervousness, restlessness or irritability, shivering or trembling, abdominal cramps, weakness, and increased blood pressure. When the emergency is over, put the Narcan nasal spray back in its box and throw it away in a place that is away from the reach of children. In addition to watching this video, please read the quick start guide that comes with Narcan nasal spray before using it. Talk to a healthcare professional if you have any questions about how to administer Narcan nasal spray. Please read the indications and important safety information that follows. Store Narcan nasal spray at room temperature between 59 to 77 degrees Fahrenheit, 15 to 25 degrees centigrade. Do not freeze Narcan nasal spray. Keep Narcan nasal spray in the box until ready to use. Protect from light. Replace Narcan nasal spray before the expiration date on the box. Keep Narcan nasal spray and all medicines out of the reach of children.
Always call 911. Narcan will only address the opioid-related health concerns. An individual can still be experiencing issues related to other substances. Calling 911 is an important step in responding to a medical emergency. Potential side effects. There are little to no side effects associated with Narcan. However, it should not be used on people with a known allergy to naloxone hydrochloride. Additionally, individuals can experience opioid withdrawal symptoms after Narcan is administered. Accessing Narcan. A limited supply of Narcan is available through the Student Wellness Center's Wellness and Health Promotion Department at no cost. It is also accessible through Santa Clara County's Sexual Health and Harm Reduction Program at no cost. Visit the program's website to learn more. Narcan can also be purchased through the Student Wellness Center Pharmacy and local pharmacies in the county. Additionally, the FDA has recently approved Narcan as an over-the-counter medication, making it available at local pharmacies without a prescription. Storing Narcan. Keep Narcan in its original container or box until it is ready to use. Protect from light. Store at room temperature. Do not freeze or expose to excessive heat above 104 degrees Fahrenheit. Replace Narcan before the expiration date on the box, and keep out the reach of children and pets. Reminders to keep you and the community safe. Be an upstander. Know the signs of an opioid overdose, carry naloxone, and call 911 if someone is experiencing a medical emergency. If you are making the decision to use a substance, do not use alone. Have someone with you that is not using who can call 911 or administer Narcan. Only use medication that comes from a U.S. pharmacy. Do not drive or do anything risky after consuming drugs. If you are traveling outside of California or the United States, be aware of laws regarding Narcan in the location you are going to. And lastly, combining alcohol with other drugs can be an overdose risk.